Okay, hello. Good morning, everyone. Can you hear me? Okay, it looks good. My name's Isaac Bush. I'm a developer with NMHED. So we'll be going over the state's new COVID response application. It's fairly straightforward, pretty simple. It's very similar to the Excel template you've already been using. So this should be pretty straightforward. In the past, excuse me, I'm also admitting people as they come through. In the past, as you know, we've had a Excel template that you needed to fill out and get back to us within, I believe, 6 hours. And to streamline that process, we've done is we've turned that into a website, and you'll have the ability to log in, fill out the fields. They're very similar, and then send it off to us. We collect those reports, and we can follow up with you if you need to. Let me go ahead and show you how that works. Just share my screen now. Okay, so our URL is at covidresponse.atd.state.us. And when you log in, you should see the screen, or should go to the site. The screen should look pretty much identical to this. Down here is a create new account button. We're allowing this to be open to anyone from your school. You don't need authorization from us first. So it's usual fields, first name, last name, email, phone. Please put in an accurate email and phone, because if we need to follow up with you about a specific case, then that was how we would go ahead and contact you. I click next to log in. Okay. When you log in, these tab up here for admin won't be here, but there's basically the single basic reporting, giving you the overview of what we have. And if you hit start, we have a single form here that goes over most of what was previously in our template. Starting from the top, the first thing we have is a list of all of our schools and institutions that we have here in New Mexico. So you can go ahead and find the one that you yourself are part of. This box is typable, so if you type in that you are the, whatever, you can just go ahead to search to filter it. So, and we'll just pick the one at the top. You're a better you, Barber, is on the call, then this isn't anything about you personally. We have street address information. We have your employee count, your student count. Most of this is the same as has been in our Excel template sheet. Going down, we have there been any close contacts identified? And this is where we kind of start to enable or disable bits of the form depending on what you select. So if you said that there are no close contacts, we will go ahead and disable the rest of this form so that you can just keep going down. And if there are, then we're going to go ahead and ask you how many they were and where they were. Likewise, we have the same thing with has your particular higher ed institution arranged for testing? Yes or no? Is this a out-of-state or in-state person? And then we have our next one for, is this a student, facility, staff, or contractor? For student, there's some additional things that come down about roommates and such, but for facility, staff, and contractor, a lot of that gets grayed out. So we're not going to be asking, do they have a roommate, for instance, or are they an athlete? Was this an off-campus, on-campus, or in the residence halls? We're going to say it's off-campus. Was this particular person remote, hybrid, in-person? Last, we have our 4 dates. Was this person on the campus? When were they last on the campus? When did they begin to quarantine? We have when the date of the actual test was taken, and when when the result was received. Now, by chance, I've just kind of put these in one after another, but you can these are not dependent on each other. They can all be the same day or the past or previous. I had selected this as a faculty, excuse me. So these fields are not available. So let's go ahead and switch that to student. And then we'll go ahead and ask, is this student on or off campus? Are there roommates? Yes or no? If there are, then it'll ask for how many. Are they themselves on or off campus? Was this person an athlete? If they were not, it will. I see a question, and I'll circle around to that in a sec. Is this person an athlete? Yes or no? It says not applicable. Have all areas been sanitized? And lastly, about testing strategy, was this because of a rapid response, just generic survey, or neither? Neither could be a variety of things, and if so, if you can put in an explanation. And then finally, our box is for if surveillance is not applicable. And then you hit submit, and at that point, an email goes out. Now, about that question, let me switch over to chat. Okay, so the question is, I have a question about your on-campus definition. We have employee facilities apart from our main campus throughout the state. They're not technically on campus, but on our property. So I usually report these as close contacts. Is that how you would like the information reported? Yeah, I would actually feel like that. That's probably the best way to do. And if you feel like that needs to be clarified, then you can put that in the optional comments box. If you feel that is something that that is significant on how that would be broken and how those people would be separated from distance. So that's kind of it. At this point, we would go ahead and hit submit. Importantly, we've mentioned this a few times, and we're going to emphasize again, please do not include PII. We do not want to know about the person's name, their social security number, their date of birth, and other similar information. If something needs to come up, then we can follow up with you, but please do not include that part of information. When you hit submit, this gets sent off. And that's basically it. It takes you back to the start. You can go ahead and fill in if you have another case. When you hit submit, you yourself will receive an email to the address you put in, confirming that you have sent us a report. And MNHED will also receive a report. If it is part of a rapid response, we may go ahead and follow up with you potentially, or we may make a note of it. But in either case, you know, that as far as excuse me, apparently I need some more coffee. In either case, that would handle it is on your part. Do you have any more questions at this point? Oh, okay. So someone says, do we need to include faculty and staff on the NMS OSHA online submission as well, or do we only report them as in this form? Yeah, go ahead.
It's Stephanie. Hi, everyone. Stephanie Rodriguez, the Cabinet Secretary for the Higher Education Department. You still have to report staff, so student staff workers, regular staff, and faculty on the OSHA form as well.
Okay. Okay, so the next one is, I have a couple questions. If a student is also employed, do you want us to indicate that they are both a student and an employee? For out-of-state residents, do you mean people who were residents of another state for tuition purposes, but live on campus during the semester, or only students who are remote to live out of state? For the first one, I would say that they would be listed as a student. We can follow up on that. Stephanie, is that your understanding?
So I actually, Isaac, let's have a sidebar on how we'll categorize that, because the governor likes to see if somebody's a student worker or work study as its own category. So we might have to add that to the staff category. And I know that's a lot of coding and stuff, so I apologize. But let's have a sidebar with Gerald and we'll figure out how to officially code that in our system. As far as the second, I'm going to give you an example. So we have a lot of students at New Mexico State University who go to New Mexico State but live in El Paso, Texas, or Juarez. So you would actually calculate them as an out-of-state student because they do not live in the state of New Mexico. That does not mean that if somebody's paying out-of-state tuition but lives in Albuquerque, New Mexico, because they're a California resident, you mark them as in-state. Is that clear?
Yeah, that's helpful.
Perfect. Yeah, thank you for the question. Or sometimes you have remote learners who are going to school at the University of New Mexico. I just had one the other day, but they live out of state and doing all of their classes remote because they can at this time. That would be out of state because they're not physically living in the state of New Mexico at the time that they're in college.
With regards to the last question, if our information, the address will stay pre-populated, we have to address. Unfortunately, you will need to type in your address each time. Although typically with browsers, they will save it after you put it in once or twice.
Thank you. Can I ask about quarantines now that quarantines are a lot shorter? So sometimes we're hearing from people and the 5-day quarantine from the start of symptoms is already over. So are there options to not put anything in the quarantine?
The quarantine is a mandatory field.
Okay.
I realize what you're saying, that, you know, sometimes the information is a bit like moot because of shorter quarantines and such. I would still go ahead and put in when that was started.
Okay. So you're saying whether we had the opportunity to put them on quarantine or not, just put the date of their symptoms start as their start of quarantine?
Stephanie, it looked like you had something to say? No? Okay. So I think that, go ahead.
Traditionally, we do start of quarantine when they have indeed started quarantine. So sometimes you've had a scratchy throat for a couple days, you still go to school, and then all of a sudden, boom, everybody in your student services has COVID or something like that. You want to then tell us when they've started quarantining and that they're indeed quarantining versus the symptom. Because we want to.
The only thing that we're struggling with here at CNM is we're getting information from people about their, COVID positive result, but by the time we're hearing that they got a COVID positive, their symptoms started potentially several days ago. So they're not going to be on that 5-day quarantine. So we started effective yesterday, this new 5-day quarantine, and so we're reporting people COVID positive events, but we never had the chance to put them on quarantine.
So for that situation, Julianne, it would be start of symptoms.
Okay, we'll do it. Thank you for that.
Thank you, Julianne. Hey, did you get your award last week?
Did I get an award? I would have loved that.
Oh man, okay, never mind then. Sorry, Julianne, I'll talk to you later about it.
Okay, don't forget.
I won't. I also see that Steph from New Mexico Tech had a question. I'm not sure if we addressed it, but it's on campus versus off campus. So on campus means somebody who physically lives on your campus within the residence halls. Off campus means somebody who lives off campus at another site. We're going to have to adjust this just a little bit. So I'll talk to Gerald about that. But off campus means you do not live on site. On campus, I'm sorry. That was the intent of it, but we'll touch base with my team.
Yeah, thank you, Stephanie. And that that was clarified too. It's kind of about our non-main campus facilities that I was asking about too, because we have sites across the state. So, how many on-campus close contacts are there? It was clarified that yes, anyone who's on our property should be in that. But I did actually have a different question that you could maybe hopefully clarify about the CDC guidelines on this timeline, because it used to be that you kind of started the clock either on the test date or the symptom onset date. And it seems like the CDC isn't referring to symptom onset date as part of the timeline anymore. They're really just referring to the test date, which I do kind of like because it is an objective measurement, unlike symptoms where people often don't really know, or sometimes they, in my experience, push their symptoms earlier a couple days, even when they've said it's a later day to get out of quarantine sooner. So we're building our timelines of 5 days from the date the test was taken. Do you recommend we go forward with that?
So the state of New Mexico has adopted CDC completely, which is the one that you just said is the preference. So we've completely adopted that and we support that.
Okay, and it looks like NMSU is doing the same thing. So great to be consistent with our neighbors to the south. Thank you.
Also, Western is doing the same.
Hi, Michelle. It's great to see your faces, your voices. I feel like we email all hours of the day.
Yes.
Let's see. So I see that Director Fernandez, hi Roxanne, good to hear and see you. Is asking about quarantine for 10 days. It is actually quarantine and isolation for 5 days now, Director. We're following the CDC guidance.
Okay, so they won't be contagious. That was a concern of our students, is like, aren't we still contagious for 10 days? That's something we've always heard, I mean, from the news and all of our other CDC reports that we get.
So what the CDC is saying now, you quarantine and isolate for 5 days or until you are symptom-free for 24 hours. So I think that will alleviate some of your concerns. So let's say somebody got COVID, isolated 5 days, but they still have a headache.
Mm-hmm.
They need to wait until they're 24 hours free of a headache. And that may be day 7, it may be day 10, it may be day 14, but they really have to be monitoring those symptoms. And once the 24 hours has passed, CDC has said you are more than likely not contagious at that point anymore because 24 hours have passed since the symptoms have left.
Okay, and if I chose to continue with 10 days, is that something that I can legally, or do I just still have to go by the CDC guidelines?
That's something I would talk to legal about. So Roxanne, if you have somebody who does legal at your school, that's great. If not, we can touch base with my legal team. But right now, at this point in time, HED is only requiring the 5 days per CDC plus the 24 hours of no symptoms.
Okay, great. Thank you so much. So good to see you too.
Good to see you, Roxanne. Yeah. And Isaac, I'm sorry I've taken over. I hope I'm helping.
Oh no, actually, that's very welcome. I'm in a better position to answer technical questions than those kind of policy questions. So
if testing is unavailable, this is a fantastic question. So if testing is unavailable, but your student has had symptoms, they're not able to test, you should assume that they're sick and you should be careful that it might be COVID, meaning that they quarantine for 5 days, they do not return to your campus until they've had 24 hours of no symptoms. Thank you, Paul. Hi, Director Kempner. Go ahead.
Morning, everyone. Let's see if I can unmute myself successfully. Can we talk a little bit about what 6 hours means for reporting? I sometimes check my email at 11 p.m. I know we've all been in that spot. Does that mean I need to get on the form at that point? Are we talking about work hours? How are we defining 6 hours for the reporting requirement?
So, unlucky for you, Director Kempner, that is New Mexico Environment Department rule, and it is mandatory 6 hours. not including, so 6 hours consecutive. Doesn't mean business hours versus nighttime hours. It means as soon as you find out, you have to report it within the 6 hours. There's no wiggle room for us at HED whatsoever on that requirement.
Thank you.
Steph, do you have another question?
Nope, sorry, I'm just not used to this platform. Didn't put my hand down. Thank you.
You're welcome, no worries. I'm just making sure I haven't missed any in the chat. Karen, go ahead.
Thank you. And this is actually already mentioned in the chat, and I just wanted to clarify. It was mentioned, someone is not able to find a test or there's complications in scheduling an actual test. So then we would do the 5-day quarantine based on onset of symptoms. But the other question that I have is the 24-hour rule. Some symptoms don't go away in 24 hours, loss of taste and smell and those types of things. So how would we address 24-hour symptom free? Is it just the fever? Is it only specific symptoms? Or how would we address that piece?
Yeah, this is where it gets into the doctor territory, where we want to be very cautious and make sure that your student is consulting a nurse on the hotline or a doctor, the regular doctor, to determine if it's a symptom that will be ongoing, such as a cough. We get that a lot too. Somebody will have a cough for a full year before that goes away. So the biggest thing, Karen, is ensuring that your student is communicating with your health center to determine that, or the nurse hotline, which is free to the students, or getting some sort of correspondence or confirmation from a doctor to say that your cough is going to continue or your loss of taste, things like that. The ones you really want to be concerned about is headache, nausea, diarrhea, fever, flu-like symptoms. Those are the ones that really you should not let your student come back to campus. But the loss of taste, loss of smell, and cough usually does linger longer, and those ones you just want to verify with a healthcare expert.
Thank you.
You're welcome. Thanks for the question, Karen. Any other questions?
I think there was one about environmental reporting was 4 hours, but has it shifted to 6?
I think, let me double check that with the environment department.
Yeah, I've always heard that for faculty and staff, for employees, it was 4 hours to OSHA.
Hi, Secretary Rodriguez. This is Vanessa Grain at New Mexico Tech.
Hi, Vanessa.
How are you?
Good. How are you doing?
Good, good. On the rapid response website for environmental, it still shows 4 hours. So we've been following the 4-hour guideline. That's why I asked that in the chat, because.
Yeah, it is 4 hours. Justin from Environment Department just messaged me back.
Thank you.
And I apologize. It's really hard when you're trying to oversee colleges and universities, but everybody else is doing rules and regulations. So I appreciate your patience with us. So contact tracing. David, this is a really good question, because I think what you're trying to get at is sometimes, and Julianne had mentioned this too, sometimes you have a student who reports that they were COVID positive, and then they report it 10 days later. So is contact tracing necessary at that point? I would have to check with our professional contact tracers at DOH to determine if that's what they've been doing now in this new mode and the increase in cases, David, but let me go ahead and check with them on that.
Thank you.
Hi, Kathy, I see that your hand is up.
Yes, on the section where it talks about, did this case result in rapid response or is it part of surveillance? And then neither. So if our students are just, they're calling in, gone to the doctor or I did a home test and I'm positive. So on those, do we just mark neither and have to do an explanation? Because that's what the majority of mine are.
Yeah, so long as your student has not been in campus and did not have close contact, that would be a neither response. If your student came onto campus, was sitting next to somebody less than 6 feet in a classroom, more than 15 minutes, that's considered a rapid response and would be marked as that.
Okay.
Thank you, Kathy. Long time no see. Let's see. Karen, do you have another question?
Oh, no, I'm sorry about that. I just didn't do I didn't put my hand down. Thank you. I'm sorry.
No worries. All right, if there are no more questions, this portal will be live today at noon. So go ahead and start using this. If we start emailing your team and telling them, hey, you need to fill out this form now, just excuse or just please be patient as we transition to this new system to ensure that we're getting everything that is coming in and we can monitor surveillance and rapid responses better in the future. With that, you know where to find us. Go ahead, Isaac, I'm sorry.
Yeah, there was one last question. Someone had a question that what if it's both for testing a surveillance that required a rapid response?
That's a good question. So if it's a surveillance that required a rapid response, mark it as surveillance, and we'll be able to tell from the notes that you're doing that it was indeed a rapid response. So what's going to be flagged for us is surveillance and rapid response for us to verify that surveillance was treated as a rapid response. It just will not go towards the watch list through the environment department.
I think that was the only one I saw.
Thanks, Scarlett. Thanks for joining us. All right, everyone. Thank you so much. If you have any questions or concerns, you can always email our email, which you all know by heart. It's covid.nmhed@state.nm.us, and we'll go ahead and help out when we can.
Okay. Thank you.
Thanks,
Thank
Dad.
you.